Hi, I'm Dr. Jim Carlson from the Riverside Animal Clinic and Grove Animal Hospital, and we're going to be demonstrating the dentistry today as far as intubation and the whole process from start to finish. A lot of times veterinarians may be accused of cracking teeth when we're doing a procedure like this, but we want to demonstrate to you that this is a very safe procedure, and it's not reasonable to assume that just because we're intubating and opening the mouth that we're going to be cracking the teeth. So we have our little patient here that's about to be induced. She's had a pre-medication just to help her relax. Wonderfully relaxed little dog here. And so first of all, we've got her catheterized, so I'm going to start the induction phase first. The induction allows the mouth and jaw tone to be relaxed, so the top of the airway can be viewed, and then we can put the intubation tube into the airway so they can breathe gas. So I'm going to do that now. So we got our injection port and we have our induction anesthetic. We'll go ahead and give that. Give it very slow. About halfway through, so we just start to see some relaxation now. And just a little bit heavy. There we go. She's doing well. We go slow and we watch it all the way through. Good girl. Now she's relaxing, and we got her in sternal recumbency here, so she's laying on her chest. Our next step is we're going to use the tube, and we see this is just a rubber tube. It's not anything that's hard, and we can see as she has some dental tartar. And during the oral evaluation, we predetermine, and this little guy has a cracked premolar already here going in. Canine is just tipped off a little bit right there, just normal wear and tear points. Dogs not only eat hard dog food, but chew on hard treats. And so oftentimes they come in with a lot of wear and tear on their teeth. So as we gently pull our tongue out, we're going to go down into the throat. And we're going to place the tube in the airway, like I've done right there. And you see that there's no way we can slam the jaw shut because it's right on the tube. So there's no way that those teeth can clack together or be cracked in any way during this process. Now I'm going to tie the tube in. The reason we tie it in so it stays in place during the procedure. And the reason we intubate is to make sure that they don't aspirate any water into the airway. So now we're going to hook her up to gas anesthetic to maintain the depth of anesthesia to finish the dental procedure. Nancy's going to hook us up here. There you go.
Now we're just going to blow up what we call the cuff, which is a little inflatable area around the base of the tube where it goes into the trachea to fully fill up that space so no water or dental debris go down into the lung area.
So bacteria, tartar, water,
all of that debris, yes.
It's blocked off so it doesn't go down the airway, so we have a complete airway protection. It also allows them a way to maintain their depth of anesthesia during this process, and it's very safe and allows us to have complete control of the depth of how deep they are and also how light they are.
How many dogs would you say come in, like roughly? Nancy, you've been doing this for 30 years, and Dr. Carlson, you've been a vet for 16 or 17 years now. How many dogs that you do dentals on come in with cracks, damage, chips, that kind of thing?
I'd say well over 80% of dogs that come in with some sort of wear and tear on their teeth, because most dogs are on a dry dog food They get dry dog biscuits to eat. They get some sort of dental chew. They have some sort of dental chew toy that they're eating and chewing on. So they do a lot of work on their teeth, and it's built by design because dogs have to exercise their jaws in order to have a very safe mouth and a very healthy jawline. And so that helps the teeth and jaw drain well. It helps to reduce tartar and gingivitis, and it's very healthy for them to do it.